All right, and turning to the coronavirus, COVID cases are on the rise all across the country. And here in the Gem State, COVID case rates have been slowly dropping since April. But a slight uptick in the past week has some experts worried. Our Andrew Bartline joins us now in the studio. And Andrew, you've talked to the Department of Health and Welfare and a member of the governor's coronavirus task force. What's their concern?
Shira, the experts I talked to say the uptick at face value isn't of concern just quite yet. What does concern them is the Delta variant. Idaho already has 9 confirmed cases. They suspect much more as this variant is more contagious. The saying goes, take a look at the big picture.
Much better place than we were back in January.
It puts Idaho's COVID rates into perspective.
Idaho is generally doing well compared to our neighbors.
But since the start of July, Idaho's infection rate is on the rise. And Dr. Christine Hahn with the Idaho Department of Health and Welfare has an idea why.
The Delta variant, I think, is already having an impact. If you look at our numbers on our state website, we are already seeing a trend up.
Experts say the Delta variant is more contagious and will be the primary strand. Idaho has 9 confirmed cases in the state, but because of how Idaho's tests are processed, experts say that number is inaccurate.
That is not reliable. It's a very low number. Extremely small percentages of those samples get actually sequenced so that we could tell which strain of the virus you have.
Dr. Pate says the Delta variant is doubling every 2 weeks, which makes him look at graphs like this with a keen eye, but he's not panicking yet.
If this continues through next week, then we've got a problem, but it certainly looks like we might be headed up a little bit, so I'm watching that.
So talked about the levels of protection against the variant. He says just getting 1 dose of the vaccination offers a reasonable amount of protection against COVID, but with the Delta variant, that first dose doesn't offer much. And for people who are fully vaccinated, you still have high levels of protection, but it is less. Shira.
All right, good information there. Thank you, Andrew Bartline.